Mood disorder mania. Mood disorder is a disturbance in internal emotional state of an individual. Mood disorders are classified as follows: manic episode, depressive episode, bipolar mood disorder, persistent mood disorder related to another health condition, and substance induced mood disorder. What do you mean by mania? Mania is a mood disorder characterized by euphoria or elevated mood, increased psychomotor activity, and flight of ideas. There are three stages of mania: hypomania, acute mania, and delirious mania. Hypomania is a mild form of mania that may not be recognized as a significant symptom by those around the person experiencing it. While hypomania affects sleep and activity and may lead to increased impulsivity, it usually doesn't require hospitalization. Episodes of hypomania also last a shorter amount of time than manic episodes. Acute mania. During acute mania, an individual may experience increased impulsivity that causes them to act in a way that is brash, inappropriate, or promiscuous. People with acute mania will also likely have increased energy, get little to no sleep, and talk very quickly, often jumping from topic to topic. They may experience some symptoms of psychosis where they are not fully aware of or connected to reality. Delirious mania. Delirious mania is the most severe of the three stages of mania. Its symptoms are similar to acute mania with the addition of delirium. Delirium is temporary confusion and a decreased ability or inability to connect with reality. The person with delirious mania may be too confused and disorienting, hence, people experiencing it need to be hospitalized to prevent injury to themselves or others. Causes of mania: genetic or family history. People whose parents or siblings have the condition are more likely to experience a manic episode. However, having a family member with manic episodes does not mean a person will definitely experience them. A chemical imbalance in the brain. Stressful life events such as loss of a loved object or death of a loved one, divorce, unemployment, trauma, abuse, lack of sleep or changes in sleep pattern, negative thinking about self, seasonal changes, social factors like failure in life, financial difficulty, and environmental stress, side effect of certain medications or health conditions. Symptoms of mania. Main features of mania are euphoria or feeling extremely happy or excited, increased psychomotor activity or having an abnormally high level of activity or energy, and flight of ideas or having lots of thoughts on lots of topics at the same time. Other symptoms include decreased need for sleep and food, distractibility, irritability, impulsive behavior that can lead to poor choices, unable to concentrate, inappropriate social behavior, poor judgment and hypersexual, pressure of speech. Person is more talkative than usual. Speech is so forceful, rapid and strong that it's difficult or impossible to interrupt. High risk activities without thinking about the consequences. Excessive involvement in pleasurable activities, grandiosity, and they are hyperactive and may experience hallucinations or delusions. Treatment for mania may involve therapy, hospitalization, and medications such as mood stabilizers, anticonvulsants, and antipsychotics. While this may be the typical course of treatment for many people, each person's situation is unique, and someone with specific questions should seek the advice of a mental health provider. If your mania is severe, you may need to be in a hospital until your symptoms are under control. Electroconvulsive therapy or ECT may also be something your doctor considers. ECT is one of the fastest ways to relieve symptoms in people who have mania. Prevention. Educating the patient and family members about mania and paying attention to side effects. Exercises like running, dancing, swimming will be helpful. Avoiding high stress situations. Different things work for different people to help relieve stress, like listening to music, spending time outdoors, and spending time with family and friends. Trying relaxation techniques like deep breathing, meditation, and yoga. Joining a support group or talking to a trusted friend, making healthy choices like healthy eating and sleeping habits. Regular sleeping schedule is very important. Manic episodes should not be taken lightly because it affects your ability to perform as usual in work, school, and social activities. Avoid drugs and alcohol. Using alcohol or recreational drugs can worsen your symptoms and make them more likely to come back. Avoiding these substances can help you maintain your emotional balance. It may also help make recovery easier. Seek advice from a professional. Most important is reach out to your mental health provider, maybe psychiatrist, counselor, psychiatric nurse, social worker, and take treatment as early as possible. Thank you.